It's my great escape. I am Clint Eastwood. I am Steven Seagal. I'm thin. You know, I'm all these things when I'm watching TV. I love movie quotes. And when I was in medical school, there's nothing better than I loved than put a tape in the VCR. You remember when we used to have the tapes? You know, I know now it doesn't exist. And my son, light of my life, stuck one of these in the VCR. Okay? I didn't have money, couldn't buy a new VCR. Now it's over. All of my enjoyment, my private time is gone because little booger stuck a peanut butter and jelly sandwich in my VCR. So I believe in corporal punishment, and I believe I'm going to kill him for what he's done. Okay? But those of you who have children, they can run quite fast. So I don't want to have to chase him for the execution. I'd like him to come and get the beating that he's about to receive. And he knows exactly what he did. So he goes out the door, and I said, Nathan, Daddy's not mad. I'm not mad at you. Come here. No, really? You know, I'm cool. I'm not. Look, I'm not mad. Just come here for a minute. Come here. Come over here. I chase him around the yard. Why is that? You know, I give him all the body language. Yeah, I'm fine. Everything's good. No, there won't be a beating for what you've just destroyed my life. And just come over here. How do we have this in our normal day? Our normal day is we communicate in a lot of different ways. I go, hey, Paul, how you doing? Paul, how are you doing?
I'm fine.
What's wrong with Paul? Did you hear him? He hasn't been right all day. Yeah, there's something wrong with him. Right? We do that around the office all the time. People they tell us one thing, but there's something else that we read. And I'm just going to say, whatever it is, we're going to call it non-conscious communication. Our other body signals, our other energy, whatever it is, we read this all the time. Kids live and die on this. Animals live and die on this non-conscious communication. And they won't be talked out of it. Only we are smart enough to be talked out of what we actually feel and try and make it fit some other pattern. I'm calling this what I receive and what I perceive. You know, Paul tells me consciously, Mike tells me consciously what's going on, but I'm getting these messages. They're absolutely coming in. And I'm going to relate it to our palpatory profession as far as I'm feeling a release, I'm feeling this is something significant. If you're feeling cranial rhythm or visceral rhythm, these are real deep parts of a person that are not lying to you. They don't have the ability to trick you. Their mind does. We're taught as adults that this is not real. You know, Paul really is fine because he really said he was fine, and I should operate on that. I tried to tell Nathan that I really wasn't going to kill him, that he shouldn't believe the body signals he's reading, but he knows, he trusts absolutely what he feels. Those of you who have animals, cats, dogs, actually my wife pulled out some YouTube thing of somebody who had like a full-grown lion in New York like a few years ago, so I don't know what you got around here actually, but those of you who have animals, your animals know they read your feelings. They know when they've done something wrong, they hide under the coffee table. They know when you're really sad and inconsolable, and they come around and they're nice to you. So there is this other level, and I think this is what we're trying to operate on with cranial or visceral, or I don't care what name you give the course. If you're trying to actually hear a person's deep-seated problems and actually trying to release it, you have to be on that non-conscious, non-thinking, receptive area. And we operate on it, you and I, every one of us in this room. And I'll give you an example that everyone can identify with. Have you ever gone to, you're going to go to some social meeting with your significant other. In this case, I'll say my wife is going to, I'm going to go and meet her best friend's husband. So we're going to be a fourple now. So I'm supposed to like him because it's her best friend and it's the husband. So I have to like the mate, okay? And you go and he hasn't done anything to me. I don't know him from boo. And you know, you just meet and you're like, this is just not going to work. Has that ever happened to you? You just met someone, they haven't offended you, they haven't said anything, you don't know anything about them. And you try to make it work and it just won't work. Have you ever experienced the opposite? You meet somebody, you meet them in a bookstore, in a coffee shop, you don't know each other from Adam, and you go, wow, I really like them. And it becomes one of the easiest relationships you've ever had with no work. And it doesn't matter what you do, what your profession is, what your interests are, it becomes no work. There's some other communication, I believe, that we respond to or that we can. Me trying to treat you based on what you're telling me, the patient, is this. I took this out of the New Yorker. It's just a self-made prison of trying to make your complicated story and the things that you want to tell me and the things that you want to hide from me, trying to make all this fit. Okay, it is much more work than just listening. A child I could teach to do deep palpation. I could teach a child to do cranial rhythm. I don't know what they're going to do with it if it doesn't end up buying a toy, but I could teach them to do it because they operate on this world completely. I think for us to operate at our highest level, for me to operate at my highest level, you just have to allow these things to come up into your consciousness without challenging it. It just is what it is. If you feel something, don't make it fit a filter. Don't make it fit anything I told you. Don't make it fit anything anyone has told you. It just is. If it doesn't fit any pattern, it just is. Then you can take that thing that is and put energy into it, or love into it, positive energy into it, and I think the patient has the best chance of possibly being well. That's what I think. Took this one out of another, probably New Yorker as well. Here's nonverbal communication we do every day. I don't know if you use this up here. We use this in Philly. It's an Italian thing. It's not a form of endearment if someone should do that to you. So we know these two guys don't like each other with no words. Lastly, I took this out around Halloween time. That's not actually me. Some people thought that was me in the photo. But I took this out of the newspaper. And for me, this is the patient coming in and saying, my back hurts, I hate my job, I got a headache, and they give you their whole long list of complaints. Okay, their social problems, their job problems, their back problems, the car accident they had. It's very difficult to try and begin and decipher what is the real problem here. What is the chief monster? So this is me. For those of you who are Dungeons and Dragons fans, that's my Vorpal blade. Why are you smiling? You're far too young for Dungeons and Dragons. I had Dungeons and Dragons back when it was 3 books. Men and Magic, Monsters and Treasure, and what was the other one? No one else wants to nerd themselves out by saying they know. You all played Dungeons and Dragons, I know. Okay, no? Okay. That's you're another story. So, anyway.
Bottom corner.
This one?
No, the other one's me.
The other one? So, I think where I'm trying to take you, or what I want to show you, is the techniques that we're going to do many more techniques tomorrow because we're going to be rolling much faster. But it will never be the techniques that's going to unlock something. It will be you being quiet and doing very basic things and listening very well. And the patient has a responsibility, and I believe there's some other energy that is partaking of whatever healing that may happen. And I always look at that as a may happen. That way it's not on my shoulders that I'm responsible to treat you. Because then it will take me out of my now moment in being here with you. Then I'm thinking about Steve Sanet and my batting average, how good I should be, how I should try hard. And I'm getting tested again. I don't want to be tested anymore. Being tested sucks. It's enough already. I just promised to do everything that I can do for you, and that's all that's reasonable. We have a few minutes yet. Do you have any questions on anything at all? Yes?
So when you're listening and you're feeling and you're just in your kind of in this mode of receptivity, and I'm just wondering for yourself, like what you do when you're there, and then say you get distracted or like this thought comes, whatever the thought is. I'm just wondering for you, what do you do? Do you just like let that go? Do you have some technique that you use, or
All right, I'm going to tell you what. No, I won't tell you that. There's so many thoughts that came with my inappropriate filter. I'm a human being like anybody else. Your world gets distracted by lots of things. You might like this patient, you might not like that patient. Somebody comes in and they smell bad, and you're like, I really got to deal with this. For the most part, I'm pretty good at being blank. And occasionally thoughts come into my mind, I'm a human being. And I just get back on task. I'll end it with a story this way. I had a fellow used to come to me. It was a charity case that I did. He was a Vietnam vet, really scary looking guy. 3 failed back surgeries, and just scary looking. Leather jacket, long hair. Not that there's anything wrong with leather jackets and long hair, okay? But I'm saying for our stereotype, he just looked like a scary looking guy. And I'm not going to fix this guy's problem. All I would be able to do is treat him, and he got some palliation. He felt better for a couple of days, and I let him come in once or twice a week. And if I got paid from, he was had bad workman's comp insurance, I didn't care, I just treated him. At one point my receptionist said to me, she said, how do you treat him? Because I mean, he reeked. He stunk. S-T-U-N-K, stunk. And I mean, his feet were the worst. And my receptionist, who we were very chummy with each other, I always had a small office, and she used to type my notes. And she said, do you work on his feet? She's asking me, I said, yeah, I work on Michael's feet. She said, how can you? Because the stink's coming from there. She said, and she was very tough, from South Philly. She said, you better tell him he's got to clean himself up, because she's making me sick out in the office. And I said, oh, I don't want to tell the guy. She said, how do you treat him? I said, I don't know. There's a part of me emotionally that really, I want to help the guy. And I have to disconnect it in my mind. He went to fight a war that I was a little too young for, that we can make all the arguments over why countries go to war over money and whatever, and this guy's crippled and basically shit on for the rest of his life, and he's got nothing. And you know what? I don't mind his dirty feet. I want to see if I can do something to help him. But I have to cut myself off from it, because there's a part of me that's really in love with Michael. I really want to do something for a guy who's lost his life after fighting for somebody else's wallet, probably. You know, I'm not immune to emotions. I'm not immune to feeling sorry for people. I just can't work that way. So the stink in his feet, I told my receptionist, I said, all right, you know what, let me deal with it. Let me just tell Michael. Well, she was tough. The next time he came in, she beat me to the punch. It was funny, because then I had a bigger problem. Then he started dumping a pound of cornstarch into his shoes. And then, so then I had that to deal with. When he took his shoes off, there was cornstarch all over my room. And he went back to his wife, and he said, honey, do I smell? And she said, you stink. This is what he told me. I didn't know I stunk. I'm like, well, apparently the rest of the world knew you stunk. I mean, he's wearing the same pants every time I see him. People like that, there is a part of me, I really want to do something to help them. And I really could get lost in that moment and to be in love with him. I will not be at the highest. But I can erase the stink, which comes in at me. It was an assault, let me tell you. It was a frontal assault. But it didn't bother me. Other things bother me more. Rich people with their namby-pamby problems call my office 57 times for whatever psychological thing. That irritated me more. I didn't want to deal with them. And they were paying me. So I'm a human being just like everyone else. I get distracted like everyone else. I fail in cases like everyone else. But a lot of times I see something really great happen, and it happens in quiet moments. So your problems have to be checked at the door, and you have to be clear to treat them. So I get distracted. It doesn't stay with me too long. I can stay really in the moment. And I enjoy the personal ride. If it's someone I'm attracted to, someone I dislike, those thoughts don't come at me a whole lot. I enjoy the ride of feeling whatever it is I'm feeling. It's like it's like being a bartender and getting to hear everybody's gory tales. But you get to help them a little bit. You know, they tell their bartender, they tell their hairdresser, they tell their osteopath. I've heard some great stories.